Okay, ready? I'll call the November 17th, 2020 Todd County Board of Commissioners meeting to order. Attending remotely will be the news media. Attending in person will be Steve Ock, Sheriff, Lauren Feldbaum, Public Works, Mitch Johnson, Facilities, Jackie Ock and Catherine McInditz, Health and Human Services, Adam Ossifert, Planning and Zoning, Rick Utek, Economic Development, Denise Geider, Auditor Treasurer, Chris Pelzer, our County Coordinator, and all commissioners are present. And welcome to the public who will be viewing us online. And let's stand for the pledge, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. I should add that when I say attending in person, these people will be coming in from the outside, not all attending here in person. So the public understands that we don't have these people all sitting in here. All right, is there any corrections or additions to the agenda?
I have none, sir.
None? Commissioners?
So moved.
Okay, move to approve the agenda. Kneisel, is there a second?
Second.
And second by Commissioner Becker. Is there any more discussion? If not, all those in favor say aye. Consent items.
Today we have meeting minute approval, November 2nd and 10th for 2020. Gambling permit, Burrillville Sportsman Club. Authorization to hire temporary emergency equipment operator. Appoint public health nurse. Appoint registered nurse.
Okay, you've heard the consent items. Is there a motion to approve?
Can I have a discussion, just, the gambling permit for the Burrillville Sportsman's Club, how do we handle that? Can we just give it out, being that things might be changing as far as governor's
Well,
mandates and so
they'll follow
forth?
the mandates. They just need to get application made so that if they can have it, that they have
Okay.
it, because there's a process that it has to go down to the state approves it, sends it back.
Okay,
So they'll follow the conditions of the governor's order, but they're just making their application so they have it.
They
okay,
probably still sell like raffle tickets and stuff?
Yep, raffle
Yeah.
tickets, or if it's
Okay.
to do with pull tabs in some place,
Yeah.
or,
Okay.
Yeah.
So do I have a motion? Did I have one?
so moved.
Motion by Commissioner Becker. Is there a second?
Second.
Second by Commissioner Erickson. Discussion? If not, all in favor say aye.
Aye.
Carried. Thank you. Treasurer?
First item I have today is approved commissioner warrants. Background is sent for your review. Recommendation to approve the commissioner's warrants with an ACH and a regular manual payment totaling in the amount of $164,179.33.
Okay, you've heard the board action. Is there a motion?
So moved.
Motion by Commissioner Newman. Is there a second?
Second.
Second by Commissioner Kneisel. Discussion? If not, roll call, please.
Commissioner Newman?
Yes.
Commissioner Kneisel?
Yes.
Commissioner Erickson?
Yes.
Commissioner Becker?
Yes,
Commissioner Kircher?
Yes.
Next item I have is the Health and Human Service Commissioner warrants. Background is sent for review. Recommendation to approve the Health and Human Service Commissioner warrants with an ACH and a regular manual payment totaling in the amount of $74,455.21.
Okay, you've heard the board action. Is there a motion?
So moved.
Motion by Commissioner Erickson. Is there a second?
second.
Second by Commissioner Becker. Discussion? Not, roll call, please.
Commissioner Erickson?
Yes.
Commissioner Becker?
Yes,
Commissioner Newman?
Yes.
Commissioner Kneisel?
Yes.
Commissioner Kircher?
Yes.
Last item I have then is the Health and Human Service SSIS warrants. Background is sent for review. Recommendation to approve the Health and Human Service SSIS warrants with ACH and a regular manual payment totaling in the amount of $77,288.86.
Okay, you've heard the board action. Is there a motion?
So moved.
Motion by Commissioner Kneisel. Is there a second?
Second.
Second by Commissioner Newman. Discussion? Not, roll call, please.
Commissioner Kneisel?
Yes.
Commissioner Newman?
Yes.
Commissioner Erickson?
Yes.
Commissioner Becker?
yes.
Commissioner Kircher?
Yes.
Thank you.
Public Works.
Good morning, everyone.
Morning.
Our first item on the agenda this morning for Public Works is a final payment authorization for our 2020 construction contract. And this was the contract this year for our highway construction work with Anderson Brothers Construction. And our recommendation is to approve the attached resolution, making final payment to Anderson Brothers Construction for $209,282.18.
Okay, you've heard the request. Is there a motion?
So moved.
Motion by Commissioner Erickson. Is there a second?
Second.
Second by Commissioner Becker. Discussion? If not, all those in favor say aye.
Aye. Aye.
Opposed? Carried.
All right. Our third item on the agenda this morning is our request to approve our annual request to approve our bridge priority replacement list. This is the list of bridges on all the county roads, CSAR roads, township roads, and city streets that the county engineer is statutorily defined to manage and inspect on a yearly basis. And with this is just basically the list of projects that we have kind of slated for the next 5 to 10 years. And this list then goes to the state of Minnesota, who manages the bridge replacement program, and then uses this to send to the state legislatures to use in funding the bonding bill, which is approved every so often. So with that, we have the list of basically the next 6 years on the county road system. And then the ones on the bottom there, you can see on this list, kind of are the to-be-determined projects. These bridges are still in good shape, but we're basically just monitoring them on an annual basis. As they continue to age, we keep a watch on them in case they get to a point where they need to be replaced. And you can see the majority of the structures we have on this list are in the county system, and there are a few still remaining on the township system. So with that, I guess our recommendations are to approve the attached resolution or not approve the attached resolution. And our recommendation is to approve the attached resolution authorizing this replacement list to be sent to the state of Minnesota.
Mr. Chair, if I could.
Yes, go ahead.
Lauren, I see you have one listed on 21. Which one would that be on 21?
That'd be the one just north of Highway 71 as you come through the S-curves.
Okay,
Yep, over Eagle Creek. So that bridge specifically is the deck is starting to move. It's an old wooden bridge. And the deck boards are going with the lane of traffic, and as traffic goes across it, it moves just
Okay.
because of the age, and we can't keep a surface on it. So that's why that one is listed.
okay.
Okay, is there a motion?
So move.
Motion by Commissioner Becker. Is there a second?
Second.
Second by Commissioner Kneisel. Any more discussion? Not, all those in favor say aye.
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 Carried, thank you.
All right. Our last item on the agenda this morning is a request for an additional speed limit study out on County Road 10. I've gotten a number of phone calls regarding this area. If we could just move to the map, please, just to show you where it's at. So basically, we're talking on County Road 10 on the west end. You can see the west limits are the Douglas County line. And there are a number of cabins that basically are down towards the lake, and they kind of come up their driveway a little bit and get onto the road. And with the curves there, there's a bridge with some guardrail, and then what we know it as, I call it Melky Corner. I think the locals kind of call it. There's a Melky family that lives in that corner there. There's some guardrail there that continuously gets hit. So with that, the residents have expressed an interest to look at a speed limit study, and I think they've actually reached out to Commissioner Newman on this as well. So with that, per statute, we're required to make this request then to MnDOT. MnDOT comes in and does a study and then makes the ultimate recommendation for what the speed limit should be. So with that, I guess our options are to approve the attached or resolution or do not approve the attached resolution. And our recommendation is to approve the attached resolution requesting MnDOT to conduct this speed limit study to determine a reasonable speed limit from basically on County Road 10 from the Douglas County line to 500 feet northeast of Eagle View Drive.
Lauren, how do they do that? How do they do that testing? What do they do?
There is a number of things. They obviously drive the road, take a look at the signs, they take a look at the crash history, but the main part of the study is they go out there and they conduct a speed study. So they do it from anywhere from 2 to 4 hours. They take the actual speeds of the traveling public as they drive by. They graph it, and and they graph it to find the 85th percentile. So basically, those traffic going at the 85th percentile, that's what they set the speed limit on. So the speed limit may actually stay the same if the cars that are going there are going 55 miles an hour. They've determined that's the safe speed based on people's reaction and perception of how safely to travel that road.
Okay.
I'm assuming in this area, based on the crash and the curves and the connections of how it's all laid out, we'll probably see a reduction in speed, probably down to 45, 40, somewhere in there.
Are there, curve warning speed signs there, like 45?
Yeah.
There is some curve signs, there's some advisory signs there, the little yellow placards below. But since it's a yellow sign, we call it black on yellow, they're just warning signs,
Right.
and they're not enforceable.
Right.
This would be an actual white, black on white sign, which is a
Okay.
regulatory speed limit sign, which then is enforceable.
Okay. Okay, you heard the request, is there a motion?
I'll make a motion, Mr.
Motion
Chair.
by Commissioner Newman, is there a second?
Second.
Second by Commissioner Erickson, any more discussion?
Yes, Mr. Chair.
Yep.
And then about another, I suppose, 500 feet from the county line is a public access in Douglas County, boat access, so you have a lot of traffic there too. So I did talk to Commissioner Rapp from Douglas County, so hopefully he felt that they'd support this too.
Okay, good.
So, and then there's a lot of people using that County Road 73, which is 85, 73, and
Yep.
then it's a cut across to go to Ellick, so,
There's a lot of turning movements there, so.
exactly.
Okay, anything else? If not, all those in favor say aye.
Aye.
Opposed? Carried, thank you.
All right, thank you very much.
All right. One item up for bid today was to update the contract with the Midwest Medical Examiners out of Anoka County. Background, Sheriff Stivak would like to sign an updated contract with Anoka County for medical examiner services. The contract will be an amount of $32,000 billed quarterly, which includes autopsy services and related consultations. There is also a monthly administrative fee of $125 billed quarterly. This updated contract has been reviewed by the county attorney and was discussed in the November 2nd work session. So the options are to, one, approve the updated contract with Anoka County, or two, do not approve the updated contract with Anoka County. And recommendation is to approve the updated contract. Is a budgeted item.
Okay, heard the request, is there a motion?
So
Moved by Commissioner Canizos, is there a second?
Second.
Second by Commissioner Erickson. Discussion. This is a reduction, right?
Correct.
And this is a move toward doing what you talked to us at the work session.
Correct. They would, once this gets approved, we'll make a phone call down there. They'd come up and train our deputies, and we would be responsible for doing the death investigations.
Have we reflected that in the new budget?
We will, when we have our finance. It had to
Okay,
pass here
okay,
first, but we'll
alright.
update that.
Okay, any other discussion? If not, all those in favor say aye.
Aye.
Opposed? Carried.
Thank you.
Facilities, is Mitch out there?
I will take a quick peek. There he is.
Morning, everyone. Morning, Mitch.
So I have one item today. The background is the Annex 1 and 2 backup power generator has failed and is no longer operating. After going out for bids and options, it was recommended to be replaced by Cummins generator at the price of $23,944.14. The options are to approve the purchase of the new backup generator from Cummins generator for $23,944.14, or do not approve budgeted requests. The recommendation is to approve the purchase of the new backup generator from Cummins generator for $23,944.14.
Okay, you've heard the request, is there a motion?
So moved.
Motion by Commissioner Newman, is there a second?
Second.
Second by Commissioner Erickson, discussion.
Yes, Mr. Chair, how old was this generator? Old,
So,
isn't it?
and this is where the problem lies. It was 1964 generator. We're just hoping to gimp it along, but unfortunately, that didn't happen. So we're, this is our best option. There was other options for, I wanted to make sure that the option that the county took was in the best interest of the county. With as far as, hey, should we go to just one big generator with the sheriff's office, or do we go for an extended warranty plan, or do we, just take the option of the generator and go from there? And that's the option that I feel is the best. Usually, if you're going to have a breakdown, especially on a generator, we do the routine maintenance on it. It's going to be after that 5-year mark, so that's why we kind of opted out of the option of the extended warranty. We do have a warranty on parts and those type of things, but we felt this is our best option. It's unfortunate these things happen. You can do the best maintenance possible, but if it's from 1964, eventually it's going to need to be replaced, and it's probably something that maybe should replace a little bit earlier, but that's how it goes.
What's that make it? How many years old?
What would it be, 50 some?
60, isn't it?
Yeah, 60, pretty close. I mean, so yeah.
Well, if we
Yeah.
get 60 years out of the new one, why-
Yeah, it's gotta be 60 years for a new one. No, so, we do, like I said, we did routine maintenance on it. I checked it. We were on a schedule to run it. I would manually put in a run. Now with the new one, what will be nice, it'll have its own schedule, just like the sheriff's office one, where it will automatically run without us having, it'll just have an automatic flip over switch. And then I'll get a readout back saying, hey, this is what happened. It was a normal practice or something failed, and then, we can address it as that comes. So,
is that in the basement over there?
yes, it is
How
in
do
the
you get that out of there?
manpower. That's how we're gonna get out. The new one will be located, will be fenced off and to the right of the entrance of the lobby. I did express to, everybody that was involved that, what about noise and when this thing runs? And they basically said, with the new technology, they're very, very quiet. We're gonna put a privacy fence so it won't be unsightly and those type of things. So yeah, it was, our best option is to move it out of there, get it out of there and
Yeah, great. Then
So-
you can work on it better too.
Exactly. It gives us options. If we have somebody that's coming in to work on it, I can just let them come in, work on it. I don't need to worry about, direct overvision of them, so.
And my other question too, Mitch, was the 23,000 cost installed, is that what?
So that is purchase price from Cummins Generator. We're gonna try and do some of the stuff like the gas piping ourselves, which, to be honest with you, there's not a whole lot. The one thing is a switchover switch that we have currently in place, we can reuse, and the piping out to it, the wire's already there. It should be a pretty minimal cost when it comes to those type of things. We're basically, if we didn't have any backup power at all, then it'd be a little bit different scenario, but because we had some type of backup power, it limits the cost, so.
So, Mr. Chair, what does that run on, natural gas?
Yes, it will be running on natural gas. The old one did run on fuel oil. So we are burning a better, cleaner product to burn, if that makes sense. So, but the one thing I will say about equipment that was made back in the city, they were made to last. They're built pretty heavy duty. Efficiency wasn't sometimes worried about as much as it is now. And where that line is.
I would
it's a little bit-
assume that old generator was purchased with, I bet, emergency management funds back then when they were doing, from the military or something. And they were
Military.
good machines.
Yeah,
so.
yeah,
'Cause
and-
that was a shelter down there, and or still is, so.
Yep.
So,
Yep. Okay, any other questions? If not, all's in favor say aye.
aye.
Opposed, carried, thank
All
you.
right, thanks, guys.
Did you have training with these guys on that, or? They do good. Morning, Adam.
Good morning. Morning. All right. Our first item here is the rezoning of parcel 0033000 Ruth and Ronald Pettit. Ruth and Ronald Pettit submitted an application for rezoning of this parcel from AF2 to, from an AF2 and shoreline mix to all shoreline zoning for the purposes of developing a 3-lot plat. That item was addressed during the November 5th Planning Commission meeting, and the final recommendation from the Planning Commission was to rezone this parcel to shoreland. The options are to move to approve the rezoning of parcel 030033000, deny the rezoning, or move to remand it back to the Planning Commission, and the recommendation at this time is approval of the rezoning of parcel 030033000 to shoreline zoning.
Okay, you've heard the request. Is there a motion?
So moved, Mr. Chair.
Motion by Commissioner Newman. Is there a second?
Second.
A second by Commissioner Erickson. Discussion?
Yes, Mr. Chair. Is this the plat that went to the Board of Adjustment?
No. Nope, this is a whole separate one.
Okay.
Yep. That one is still, actually, it's gonna go to the Planning Commission, in December now. So that one's still coming down the line.
Okay.
Any other discussion? If not, all in favor say aye.
Aye.
Opposed? Carried.
Okay, the R&J Edition preliminary plat, a subdivision request to establish a 3-lot preliminary plat on parcel 030033000 was approved by the Planning Commission on November 5th, 2020. The final recommendation from the Planning Commission was to grant the preliminary plat with no conditions. The options are to approve the establishment of the RJ Edition preliminary plat, move to deny the establishment, or remand back to the Planning Commission. And the recommendation at this time is approval of the R&J Edition preliminary plat with no conditions.
Okay, you've heard the request. Is there a motion?
So moved.
Motion by Commissioner Newman. Is there a second?
Second.
Second by Commissioner Erickson. Discussion? Not, all in favor say aye.
Aye.
Opposed? Carried.
Okay. The rezone of parcel 15004000, Doug Lean. Doug Lean submitted an application to rezone parcel 15004000 from AF1 and shoreline mix to all shoreline zoning for the purpose of developing a 20-lot plat. That item was addressed during the November 5th, 2020 Planning Commission meeting, and the final recommendation from the Planning Commission was to rezone this parcel to all shoreline zoning. The options are to move to approve the rezoning, deny rezoning this parcel, or move to remand it back to the Planning Commission, and the recommendation would be approval of rezoning parcel 15004000 to shoreline zoning.
Okay, for the request, is there a motion?
So moved.
Motion by Commissioner Newman. Is there a second?
Second.
Second by Commissioner Erickson. Discussion? Not, all in favor say aye.
Aye.
Opposed? Carried.
All right, the DC Lien Edition preliminary plat. Subdivision application, a subdivision request to establish a 20-lot preliminary plat on parcel 15004000 was approved by the Planning Commission on November 5th, 2020. The final recommendation of the Planning Commission was to grant the preliminary plat with the following conditions. Number 1, submittal of a wetland delineation. 2, submittal of a stormwater management plan designed by a licensed engineer. 3, installation of a stormwater management plan prior to final platting. And 4, creation of covenants addressing who is responsible for maintenance of the stormwater management practices. The options are move to approve the establishment of the DC Lien Edition preliminary plat with the proposed conditions. 2, move to deny the establishment of the DC Lien preliminary plat, or move to remand it back to the Planning Commission. The recommendation at this time is approval of the DC Lien Edition preliminary plat with the proposed conditions.
All right, you've heard the request. Is there a motion?
Mr. Chair, can we
Yes.
discuss
Yep,
before we
go ahead.
vote?
Yep.
This plat I got some concerns with. There is no cul-de-sacs or anything on this plat. I have some questions on that, and as a board, can we put conditions on it as a commissioner? Can we add conditions to this plat?
I believe so.
You can. The other option, again, is obviously you can send it back to the planning commission, hearing your concerns today, bring that to the planning commission, and then they can change or update or whatever their recommendation, and we can extend this application also, so the planning commission is still reviewing this and involved in the process.
Well, this plat also concerns another acreage to the east of it, so there's gonna be more development in this area with no emergency turnarounds, nothing. I did submit a picture, and I was standing on, this is standing on Feather Drive, looking west
Okay?
to Fawn Drive, and Fawn Drive is just on the other side of that hill, okay? Where I was standing, there is absolutely no cul-de-sac, and there's probably, I'd say, 8 lots coming up to that point right there. So there's no cul-de-sac there. So you go on the other side of that hill there, absolutely no cul-de-sac. Supposedly, it's a private drive, but it's listed as a 66-foot public easement.
It is a 66-foot wide public road that's privately maintained.
Dedicated. Public
It's dedicated to the public, yes. It is a
Yep.
public road. Even, yeah, there's signs at the end of
So
Fawn Drive
my
saying
my
private,
question
but-
is, if you're gonna put lots all the way on that south side from a quarter mile west of there, all the way towards 141st, don't you think that we should probably put a road, or the developer should finish this road so it goes all the way through? And it hasn't been delineated yet, so we
Yeah.
don't know if there's wetlands down in there.
We don't, and that, we were hoping to have the delineation report completed by the end of this week, is what I had heard from, Mark Johnner, who's the representative for the developer here. They're hoping to have that, I think, this week, and then we know more about what the wetlands actually look like out there. I talked with Lou briefly yesterday about that, and he is assuming that there might be some wetlands down in that bottom area, but maybe not as much, because it's more of just like a drainage area. So there will be wetlands involved, but we don't know how much.
But there's another ravine just over that hill where all this water is gonna run
Yep.
into Lake Osakis.
Correct, and that was a concern when I looked at it, and where we came up with that condition of having a licensed engineer develop that stormwater management plan. So they're out there surveying it, doing the calculations of stormwater runoff, and sizing those stormwater basins appropriately, and then requiring that they actually have them installed prior to final plating, so we can address that stormwater runoff into those gully areas. There's 2 really significant gullies that go under Fawn Drive in towards Lake Osakis.
And these are one of the 11 inlets into Lake Osakis, and there's another one back to the east that runs into Lake Osakis. So, I mean, this is pretty hilly, and there's a lot of ravines
Yep.
along this area that run into Lake Osakis.
I absolutely agree, and that's why we thought it was important to have that engineer involved.
So my take is that I'd like to add a condition on that they either connect Fawn and Feather Drive as a drive-through, because it would save the taxpayers of Leslie Township a lot of money by not having the township plow turn around.
Is this a second tier?
Yes. Yes.
Well, if Randy's done, I've got something to add to that, because Barb and I have had issues, well, with Ward Township and Turtle Creek up there with a road that was done with a plot long time ago. And now they want the townships to take over, and the road is not up to township specs. So, my question is, along with Randy, is can we as a board say that in the future, or set some kind of rule that all second-tier developments must have a road to township specifications?
So if there wasn't a road already, that would be a requirement, but that's already a public road there. Well, dedicated, it's not really a road. It was never, the road was created, it was never brought up to standard, which is the reason that the township never wanted to take it
Yeah,
over.
right.
Yep. And they won't touch it until somebody else brings it up
Oh,
to standard.
that's where the developer, I had a development go around my lake, and that was the requirement that he put in a road, and the township took it over then.
Yep,
Sure, and,
and that should be a requirement that they
I
upgrade.
agree, because after the fact,
But
no
you
one wants
can't fight
anything
it,
to
yeah.
do with it.
Mm-hmm.
And then who's gonna maintain this private road that does all
Yep.
the services and they think it's a township road?
we get calls like that all the time on these public roads that are privately maintained, and the neighbors aren't paying their dues to maintain the road, and we don't have a lot of control over that. So it would clear up a lot of things if it was brought up to standard and the township agreed to take it over. Some of the things that I'm just knowing the situation that raise concerns is that there's all those those people on the lakefront that probably enjoy the fact that that's kind of privately maintained and there's not a lot of traffic through there. So they're not gonna want that upgraded, although it would be a good thing to have. But then also, that development was created in the 40s, I think, and it should have been brought up to standard then, and we're putting the burden on that in the developer now when it's the people on the opposite side in that other development that share that road with them too.
The township just upgraded that road on the other side of that about maybe 5 years ago.
Okay,
So
Yeah, I'm
it
familiar
has
with
been upgraded by the township. It just, there's no cul-de-sac.
Sure.
So if you have emergency up there, whether it's a fire or whatever, I don't know how the hell you're gonna get
Well,
in there.
With the size of the new fire trucks, it's almost impossible
Oh,
to turn
yeah.
around in there. But can't we make this a requirement on second tier and third tier, future developments?
I thought it was there at one time.
I don't know.
yeah,
I
like
mean,
road
we're-
requirements
if we're
are
talking,
there.
the Lake Shore has that already, we can't change that.
Mm-hmm.
But if we're developing now second tier, plots, why can't we as a board say, okay, this has gotta be done and this has gotta be done before we approve it?
And that's what those conditions would be for.
Yes,
if-
that's
yeah.
what I'm saying.
Yeah, so, yeah, I guess my recommendation to you then would be that we send this back to the planning commission then. We can extend this by 60 days. Today is 40 days since the date we received the application. We can extend, the county has the opportunity to extend this by 60 days without the applicant's approval, I guess. The county has the right to do that. So that would give us an extra 100 days from today to make the decision. The motion, I guess, would read something to the effect of, a motion to remand this back to the planning commission for further consideration and also extend the 60-day decision period by an additional 60 days. Then you don't need to make a decision today. We can get it back to the planning commission, review it again, and change the recommendation and see if we can get this. This will allow us to have conversations with the township, allow those lakeshore owners to submit additional feedback if they have concerns. We'll probably have the wetland delineation back by this time to know what that bottom area looks like for placement of the road. We'll just have a lot more information by that time.
So how can they do a wetland delineation in the wintertime? I have not heard of a wetland delineation being
Yep.
done when there's snow on the ground.
And that's why Lou, and they know this now, Lou's not going to approve or give his consent to that wetland delineation until the springtime.
'Cause
They
the
shut him
last-
down a while ago.
The last plat that we approved in that area to the east.
Yep.
Was delineated wetlands, and now they're having issues trying to build because they can't go through the wetlands to
Yep.
build. So,
Yep.
and this board passed that not knowing that there was wetland delineations, and we passed it. Now the people didn't have access to build, okay? So I don't know if they're purchasing credits now for
Yep.
that plat, and I'm
That's what the-
assuming they are.
Yep,
Because
they
they
are.
have to.
Yep.
But that was something that this board should have been aware of before we voted on it, saying, hey, there's wetlands that they gotta cross in order to get a building permit.
Yeah. And I don't know what the status of this is because when this was approved, it got cold and there was snow. So I don't even know if that delineator was able to get out there and do a good delineation at this time. I haven't heard an update to this point on where they're at with it.
Okay, but I agree with Commissioner Kircher that, and Commissioner Becker, we need to address this because it's getting ugly out there. And if somebody has a medical emergency or something and you can't get somebody back there to get them, that's kind of our fault
Sure.
because we let them,
Yeah.
we let them buy with it.
Sure. And I think that yeah, it'd be appropriate if we send this back to the planning commission, and then the applicant will have the opportunity to look at this and be aware of it, and if maybe they don't want to develop it, I don't know at this point, but this would bring it back before the planning commission, hearing your concerns, and allow additional time for the wetland delineation and to get that additional information that we know is coming already.
All right.
So,
Mr. Chair, if I could, say, Adam, would it be possible to send some maps when you send this out for us as commissioners? Because
Sure.
I know, Rod, you see it, but the rest of us, you know, if we're not from that area, it would be nice to at least see a location where it is.
sure. Yep.
So if you could send that in with our packet, would it be appreciated, I
Sure.
think?
Because,
Yeah.
Mr. Chair, the map that I got from Adam shows the road going straight through.
Okay.
Yeah, it's platted that way.
Yeah.
I don't
It's
know
showing
how.
straight through, so I don't
Yeah.
know if you guys were looking at that map, why you didn't say, well, geez, I was out there, there's a ravine right there.
Yeah, I don't know how that road ended up that way, because it's the plat that was created in the 40s, the road goes through that ravine and it's cut off on the opposite side.
Right.
But Feather Drive comes in to this existing plat that was platted in the 40s. So somewhere in the course of history, some strange decision was made to cut that road off, even though the right-of-way crosses that ravine. And we don't know what happened in the 50s when that was developed, so, or 40s, so I don't know how that got built that way.
Okay, all right.
Well, back then, I would assume was pretty sparsely populated in
Right,
that area.
well, and you didn't have
You know,
people
they didn't
coming
have
up
those
year-round
concerns,
like you do now.
Now we're increasing our population there, so. So what is the wishes of the board?
I'll move number 3, we send it back to the planning
Yep,
commission.
that's fine.
All right,
Nope, I was
motion by
gonna do the same thing.
Commissioner Newman to send it back. Is there a second?
Second.
Second by Commissioner Erickson to send it back to the planning commission.
And then also to include in that motion that we extend the application period by an additional 60 days.
Okay, yep.
Okay,
All right.
thank you.
You okay with that, Rod?
Yep.
All right. Anybody have any questions? If not, all in favor say aye.
Aye.
Opposed? Carried, thank you. And I'm serious about the second tier and third
Sure.
tier, about
Yep.
these roads being brought up to township specs, so we don't
Sure.
have to be fighting this
Yep.
later on.
In some of these more recent, especially in the Lake Osakis area, like with the wetland delineations and stuff, I think we can really improve our plating process in this and require things up front with that application, so we don't run into these hurdles as we go through the process. They're just done in the application. So I would think maybe we had a future work session, we could look at stuff like that.
Mr. Chair, it goes by classification, so it's either a Class A, Class B, or Class C road, and that's what you gotta ask the county engineer.
Sure.
And that goes back into the township, you know, if you're going to a Class C to Class C road, or if you're going from a Class B road to a Class B road, but that's what it pertains to.
Sure.
County engineer would know the specs and
Yep.
give them advice on it.
Sure. Okay, next one here. Anthony Reinbold, request for CUP. Request for a CUP was received to establish temporary family living on parcel 20-0018800. This was reviewed by the Planning Commission on November 5th. The recommendation from the Planning Commission was to approve this CUP with no conditions. The options are to approve the CUP with no conditions, deny the CUP, or 3, remand back to the Planning Commission. And the recommendation at this time is approval of the conditional use permit for temporary family living on parcel 20-0018800 with no conditions.
Where is this? I'm sorry, where is this at?
Gotta think about this. West of town, I wanna say it's County 38.
Okay, Clay Hill, out there, okay.
6.
6, yeah, 36 on the Clay Hill Road, right? Mm-hmm. Okay. All right, you've heard the request, is there a motion?
So moved.
Motion by Commissioner Erickson, is there a second?
Second.
Second by Commissioner Kenizel. Discussion? If not, all in favor say aye.
Aye.
Opposed? Carried, thank you.
All right, last one here. The Seibel Subdivision 4 preliminary plat. Subdivision request to establish a one-lot preliminary plat on parcel 10-0003900 was approved by the Planning Commission on November 5th. The final recommendation of the Planning Commission was to grant the preliminary plat with no conditions. The options are a move to approve the establishment of the Seibel subdivision 4 preliminary plat with no conditions, move to deny this, or 3, remand it back to the planning commission. The recommendation at this time is approval of the Seibel subdivision 4 preliminary plat with the proposed conditions. Sorry, with no conditions.
Okay, you heard the request. Is there a motion?
Move for approval.
Motion by Commissioner Newman. Is there a second?
Second.
Commissioner Erickson, discussion? If not, all in favor say aye.
Aye.
Opposed? Carried. Thank you, Adam.
Thank you.
Okay, who's up, Jackie? And
Good morning, Mr.
Morning.
Chair, Commissioners.
Morning.
All right, first BAF to present is to approve the revised tobacco sales and access ordinance revision. Some background, Todd County Tobacco Sales and Access Ordinance has been updated to align with the state and federal laws to raise minimum legal age to purchase tobacco to age 21. The ordinance was available for public comment on Todd County's website October 6th through the 30th, 2020. The ordinance had its first reading at the Todd County Board meeting on October 20th and the second reading at the Todd County Board meeting on November 2nd, 2020. Options is to approve the revised Todd County Tobacco Sales and Access Ordinance or to not approve. It's our recommendation to approve the revised Todd County Tobacco Ordinance Sales and Access Ordinance.
okay, heard the request. Is there a motion?
So moved. Second.
Motion by Commissioner Erickson, second by Commissioner Kenizel. Discussion? Not, all in favor say aye.
Aye.
Opposed? Carried. Thank you.
Thank you. All right, our second board action form is just again to update on the COVID-19 situation. As of November 16th, Todd County has 1,437 lab-confirmed COVID cases and 12 COVID-related deaths. Again, many people, I state this each time, many people with COVID-19 are not tested, so the laboratory-confirmed cases represent only a portion of the total number of people in Todd County who have had COVID-19. Cases no longer in isolation, 1,158, which is 81%. Gender, male, 48.3%, and female, 50.7% have had COVID-19. Age range, anywhere from 1 month to 103, with our case average age for Todd County is 43.1. Total COVID test performed in Todd County as of 11/12/2020 is 11,642, with a 10.8% positivity rate. Do you wish to have me go over the statewide totals? I know I do that each time, but I don't know if it's necessary. It's
Up to the
posted on
board.
MDH.
Yeah.
Board? No, yes?
I don't care.
No, it's up to you.
Okay, all right. I do have that. But anyway, case rates, our case rate from November 3rd to the 16th, we had 434 positive case rates in that date range, that 14-day, with a 177.58 case rate number. Our cases continue to rise. We continue to work with the schools and try to help them through their safe learning plans. I attended one of their board work session meetings last week, Monday, for the Long Prairie Grey Eagle School District with Dr. George Morris from CentraCare. Just more to answer their questions. Dr. Morris took care of most of that for them. It was a long, lengthy meeting for them in deciding to go distance learning for their schools. So anything that you would like to add, Catherine, that
I think it's just important to note the positivity rate. I think that's something that I know Commissioner Erickson's been interested in. And I think, again, we have a 10.8% positivity rate, and that's cumulative, right? So since the beginning. But if you look at just in the last week of October, which is the most current data we have, we had a positivity rate of 17% in Todd County, which is one of the highest in the states. The state in that same last week of October had a 10.2% positivity. The state has increased from basically 5% at the beginning of October to 10% by the end of October, and we've gone from 10% to 17%. So again, why that matters, if you saw, we had 921 tests performed in that last week, beginning of, or the end of October, beginning of November. We were having 400 or 500 tests maybe a month ago. And so that's dramatically increasing. So people will ask, well, is it because they're testing more? Yes. And yes, people are more likely to be positive. So I think we all know the concerns with that. We're not seeing this going away anytime soon, and any reason why we wouldn't see this continue to trend upwards. So it's very concerning, and I think, again, we're all sick of COVID, but it's not going away. And so it's a very dramatic increase. Again, you can see on that graph I provide, we're in a very dramatic increase right now. We had 40 more cases today. It's just becoming very concerning in our community, and I don't quite know how we're going to contain it. So I don't mean to gloom and doom, but it's becoming more and more challenging. The spread is so present across every part of our county and every part of the state that it's becoming more and more challenging to even contact trace and figure out where you got it from, right?
We had been working with the state EOC just to try and set up a testing site here in our community because our rates are so high, and had felt pretty good about that. And then Governor Walz had set up statewide testing stations at most armories that are open, which one was opened up in Wadena, so they are not looking at hot spots or community events any longer, but more at those armories to be available to test the community. That
I guess that was going to be my question to you, Jackie, is when and how can we get up a testing site in Todd County so people in Todd County
and
feel able to get tested?
Yeah, and that's what we had asked too with, you all received a letter from Commissioner Malcolm, Commissioner of Health, stating that our positivity rate was high and that was concerning. And we do these updates every 2 weeks, and I try to keep you all abreast of that, so it shouldn't have been a shock. But with that, I did, like I said, I emailed the state EOC asking for that, and our response is, we plan to open up testing centers within 30 minutes of any city, so that should meet the needs of the community. So I believe that has changed, and going to local communities and setting up testing sites
Excuse
from
me.
the state.
And I also believe last night, listening to the meeting that we were at, is that you don't need an insurance card. It's free testing. And this is up through the Wadena Armory. But there is no place in Todd County that we're offering this.
I wouldn't say that you wouldn't need your insurance card. I think they need it to help with your identity more than anything. Catherine, what experience?
So it varies. You're correct with Wadena. So Wadena is one of the semi-permanent testing sites, right? It's a nasal swab. It's run by the National Guard at their armory, right? And they were selected based on, like Jackie said, across the state. I don't think we'll get one in Todd County now that we have one in Wadena. I will say that because that is close enough, I would say, for what, they wanted to do, which was to spread them out, across the state. I believe for the Wadena testing site, you don't need insurance or a ID. You can just go and get tested. You can walk in, or you can you can sign up online. They do want you to ideally call in advance before you go, and you can go and get tested. No symptoms, anything. We have a ton of testing options right now, and I think that's a good point you brought up, Commissioner Becker. Right now, we have the saliva test kits that are now available to any Minnesotan. There's a link online. If you go to MDH's website, there's a testing options on the COVID site. Click on that. There's now a saliva test kit that anyone can request to be sent to their home. You do need to have access to technology and internet because it's like a telehealth visit, and you spit in a tube and you drop that in a UPS drop box. Anyone can access that right now. And that is also free of charge. That testing option, they will ask you for insurance and they will ask you for an ID because they need to verify that for their records. But everyone's a little bit different. We also have the Coburn's testing site, which is a great option too, Monday, Wednesday, Friday from 11 to 2, no cost. Again, typically they'll ask for insurance and bill it if they can. If they can't, then there's no cost. So it's a little different at every test site, which is confusing for sure.
And I believe there is still testing that is, that can be done at our healthcare systems. So, you can also go through the drive-through at Centricare in Long Prairie. Lakewood has also drive-through, as well as Alomere and Tri-County.
You know, when you hear all this, though, it's really confusing, because it says if you feel sick, go to call your doctor. Well, then, if you feel sick or you want to go get tested, drive to Wadena. Well, if I'm not feeling good, why do I want to drive to Wadena and expose maybe whomever, and then drive back and wait 3 days, 5 days for my test? I'm a little confused on all of that, because they want us to stay in our homes as much as possible, yet when you got it, you're supposed to go someplace and get tested.
Which is why that at-home saliva test is a good option. I will say I think what they're trying to do, Dave, and you know this, they're just trying to get as many
Limit
options out there as
exposure.
possible, right? Because some people, the drive-through at Lakewood and Centricare is a really nice option. You don't get out of your car, they come to you and swab you, right?
Yeah, okay.
Wadena is another option, I think, for anyone who has any barriers with cost, right? And then these at-home saliva kits are a great option for anyone. You're absolutely right. We don't really want to encourage people to leave their home.
And I've heard that the nasal ones are not any fun, so,
They're not that bad.
yeah. So,
Update on that though now, if you go to Centricare in Long Prairie, I had to go for a mandatory one, and they no longer poke your brain, it's a throat one.
all right.
Oh, I did hear that they are swabbing, yeah.
Throat.
It's like a strep test, yep.
Yeah.
It
Much-
varies at
much
every
nicer
site.
than the
The,
nose one.
the thing that, and I know, I have to ask this question, how can we trust the testing? I know of someone who was in the hospital, not around here, was tested, came back negative. Then he was retested, came back positive.
And from day to day, it can change, depending on
Well, it
when you're
wasn't day to day, I think it
exposure.
was the same day.
Oh, yeah, well, and he might be that 1 or 2%.
If it was a rapid test, those maybe aren't as accurate.
I don't
Again,
know.
if they're doing it on site, typically it's a rapid test in a healthcare system, but you're right. And I will say with the amount of testing going on,
Yeah.
there's inevitably gonna be some issues, but overall, the PCR test that's done, the nasal swab, the mouth swab, the saliva tests are about 98% accurate, right? So that's good.
It can't be any different than my daughter having an visit to get a test done and then waiting for a result in isolation at school, and then finding out the vial was damaged in processing. So by the time she got, would have gotten another one, she was out of isolation. So it's ironic, but and unfortunate, but it does happen.
Probably isn't a good question either, but how many of these are repeat tests?
That's hard to know.
Yeah.
So again,
It's
if you look
cumulative.
at, that's a cumulative number of tests
Right,
that have been
right.
done. You're right. When you look at that compared to the number of people, so right now, we have, 1,400 cases, right?
Right, and those are single cases. Those are not.
Right, that's not duplicative. So it's tough to know, Dave. I mean, you can kind of
Yeah.
figure out, so many people have been tested so many times too, so.
And tests completed is almost 3.5 million in the state. And yes, many of them, I mean, you look at our nursing homes, our healthcare systems had multiple tests every 10 days for weeks. So, yeah, there are many, many, many duplicates.
So Jackie, it's real interesting, these days and the length of time and so forth. Okay, I heard one person that actually tested negative, and they couldn't go to work for 14 days because they tested negative. Now, if she would have tested positive,
Would have changed.
it would have been, 10 days? 24 hours with no symptoms, correct?
Yeah.
Right.
Okay, so a lot of people are very confused with the length of,
And right, so it does depend on whether you're symptomatic or asymptomatic, and whether you test positive, and what your exposure was as on your days of isolation or quarantine, depending on whether you've tested positive or not. But, we really try to work with our health systems and get them to know what those days are. But yeah, we tell people to really follow your medical provider's advice and
okay.
and knowing
So
your
now
days.
as an employee, and I have someone that was out with it, how do I get that information to know when they can come back and when they cannot
From
come
them.
back? From where?
From that
From,
employee, because we can't share that
Okay.
without their
but
permission.
can I ask an employee for that information?
Absolutely, they may not want to share it, but you can certainly ask.
Okay.
HIPAA.
Well, that's exactly, and there's a lot of people out there that are asking these very questions is, you know, when can they come back, when can they not come back?
And yet-
And can I ask that question because of HIPAA? And yet, I should be able to find out that information.
You can ask them, they may not share that with you, and that's, you know, they're right, but, yeah, and we are still embargoed as public health to, not share the information with our law enforcement with calls and their inmates as well, so it's not easy.
Yeah.
So, Mr. Chair, I heard this morning on the radio, the governor's gonna put more restrictions on us from what I'm being told. You know, with Thanksgiving, and I figured it out last week that he is anti-Thanksgiving. But what are we gonna do? You can't lock yourself in a basement and it's gonna go away. Government cannot beat a virus. I mean, you can advise people and tell people what's in their best interests. It's gonna spread no matter if you're locked in that basement or not.
And we've got a lot of soup out there right now with community exposure. It's everywhere.
Right.
And you're right, Commissioner Newman. We've heard that same thing. It's not been confirmed with us that there's going to be additional restrictions put on the state. And as soon as we hear, we'll let you know. But and you know, we're offering education and trying to do the best we can to inform our public as well. But yeah, it's a difficult situation.
You look at the seniors, okay? We've lost probably 8 in Osakis within the last 2 weeks in our nursing home. And they've been locked up in there with no family contact. I mean, it's sad.
It's heartbreaking. My grandma died yesterday.
I know,
you couldn't even go and see
My-
her. It's heartbreaking.
my condolences, because it is.
Thank you.
They're locked in there. No family contact, no nothing.
Yeah,
And then they're dying,
alone.
and then you can't go to their damn funeral.
Thank you.
Mr. Chair, I just have a couple comments, I think, on a brighter note. Hospitalization rate, do you have any of that information with you, perchance? I think that's been.
Todd County?
Well, for Todd County or even statewide, I think that is looking good on a rate of hospitalization percentage versus infected.
We heard about 8% from Centricare
Yeah.
of their COVID, which it had been 5, so.
Oh, really?
A little bit worse. Again, every health system is different, as you
Yep.
might expect. But our hospital beds are full, and
They are here in Todd County.
absolutely, it's a critical thing. You know, what did they say? 400 people are hospitalized across the state. Last week, there were 10 beds available in the state. And the problem is, you know, again, they had these ideas of opening additional COVID units. There's no one to staff them. So everyone, healthcare, I mean, Centricare had 1,000 employees out last week. So, I mean, in their system, which
can't
is a
keep-
large system, but you can't take care of people when.
Which is why they're looking at these remote clinics, and whether they want to staff that or their, you know, main campus, to be able to keep the business going. They're also daily evaluating whether they're gonna do elective surgeries. Because if they don't have a bed for an elective surgery, then, you know, their priority is to take care of the sick that they have at hand.
Just so I make sure and understand you right, is it like 8% then of the ones testing positive are going to hospitalization?
Yep,
Okay,
correct. 8% of those who test positive will need hospital or some type of hospital care, right? Is it hospitalized or the hospital or ICU, either one?
For some
but-
reason, I thought that number was really high at first. At the beginning is what I guess I was comparing it to.
It
maybe.
was,
And maybe I'm
and then it
wrong.
waned,
Yeah,
you
it
know,
kinda
and then
went
it's
down.
now, it's,
Right. I mean, and you're right, there is
Spiking.
treatment available. We have another drug that was just approved as well. There's good treatment out there, but it's a numbers game right now. We
Yeah.
have so many cases in the state, so even if it's 5 or 8%, that's still of, you know,
The volume.
8,000,
Yeah, the
that's a
volume of
lot.
cases.
So it is, I mean, all our hospitals right now are putting out messages, and for them, that's truly, right now, they're at a critical point, and that's where they're really encouraging people again to stay home for the holidays and to do things like that, because the problem is, it's not just COVID patients. Anyone have a heart attack, get in a car accident, who needs a bed, might not be able to get one, because it's not that healthcare isn't going to do the best they can, but if they don't have staff, they don't have staff. And so I think that message is important too. It's not just about COVID, it's about anyone who needs hospital care right now. It could be very, very difficult, so.
I don't want to linger on this, but I like to ask questions. Do you think in your statement before, I think was very accurate, and I agree with it, that it's so common and so much out there now to, you know, the contract or contact tracing and stuff is so fast that it's amazing. So how close are we, or when they use that horrible word at the beginning of herd immunity, where are we at the top of the surge, or how close, or has that been any talk in the state talks or anything of that sort? You know what I'm saying, where it
Yeah,
gets
no,
so
I know what you mean.
vast?
Herd
Are we
immunity is
finally gonna-
typically 70 to 80%, and I mean, truly, if you think about it, it's a scary thing if we get to that
It
point.
is, yeah.
Because I think we have 1,400 people in Todd County that have tested positive. Let's just guess that it's triple that have actually had COVID. Let's just guess, right? So let's say about 4,000, right? Well, what's our county, 24,000?
24.5.
So we're not even close to that 70, 80%. Every virus is different too for herd immunity.
Sure.
But if, again, if we start to continue to ramp up, the hospital care, not being able to get the care you need, get a ventilator, get oxygen, will be devastating. You know what I mean? So getting to herd immunity, while it may happen in pockets of our community, and that's okay. I mean, I think, you know, some of our schools are seeing that with their staff. A bunch of their staff are testing positive, and that's why, again, it's important to get tested, so you know. But it's not something that we want to strive towards.
Right.
Because it, again, it would mean that the virus is uncontrollable. It's a wildfire, it's everywhere, and that our healthcare systems, I don't know how they would keep up. It would be impossible, and so that would be a very scary point to get to. If we see herd immunity in the next few months, that means, you know, we have 15,000 more people in Todd County get infected. That would be very challenging.
What they're, you know, so we look at today versus back in March, treatment plans are much better. What I'm understanding from Dr. George Morris, that before they, you know, if you needed more than 4 liters of oxygen, they vented you. That's not the case today, because as time lapses and they're learning more about the virus, they're also learning on how to better treat people. And they're not needing as many ventilators as they once had. So time has helped. So prognosis is better and treatment is better and not so invasive.
And who's gonna rewrite the book on how to deal with epidemics? I think, and I always say to my grandkids when they make a mistake, what did you learn from this, grasshopper? So I'm saying this to our governments and our public bodies, what did we learn from this and how are we gonna grow from this? Because this isn't our last epidemic that we're gonna deal with, or at least our later generations are gonna deal with. So how are we gonna be prepared in the future? That's what I've asked the EOC. I've asked this of everybody. We have to think outside the box now and say, how are we gonna be prepared for something in the future? This is probably, well, it isn't our first epidemic, but it is probably in my generation, but, you know, how did we react to this and how did we deal with it? We're finding out we're short of things, we didn't react properly, we didn't have the proper supplies, we didn't, all this blah, blah, blah. So what are we gonna do in the future? That's my question. So, I'm hoping we think outside the box and prepare. Yeah, we have plans, there is on the shelf of collecting dust, but we've gotta learn from this one. So,
Yeah.
Shortage of hospital beds, well, we just have a new hospital built here. They actually decreased the bedding when they built this hospital. Okay, should we do that in the future? No. I was always told when I was sheriff, never build your jail bigger than what you want, but one day you're gonna be full and say, now what do I do with all the prisoners I have? So yes, it may be a little bit costly, but in the future, long-term goal, it pays off. So hopefully, hopefully CentraCare's learned from this that we cut our bed space, now we're in trouble, so. So that's my comment. I think we need to learn from all of this and move forward and rewrite the book on how we handle epidemics, so. Okay,
Good, thank you.
Thanks for your input.
You don't know what you're dealing with.
no, you have no clue. All right, thank you, guys.
Great.
Thank you.
We'll stick around for
Yeah.
the
Yep.
COVID test kit discussion, and then we'll bug out in the hallway.
Okay, so, Mr. Chair,
Well,
the
that's
next.
next, so if you guys wanna just stay there, you can, yeah.
Mr. Chair, the next board action is to approve public health COVID-19 test kits. The background is Todd County Health and Human Services has the opportunity to purchase COVID-19 saliva test kits from Vault Health. These kits will be used for priority populations and those experiencing barriers to testing. The options are to approve the HHS CARES Act request of $38,747 to purchase saliva test kits or to not approve, and the recommendation is to approve.
Okay, you've heard the request, is there a motion?
So moved.
Motion by Commissioner Becker, is there a second? Is there a second?
Second.
Second by Commissioner Newman, discussion?
Yes, Mr. Chair. And the success rate on these are how much?
Again, as long as they're administered the way they should be, the accuracy of the test is about 98%, the same as a swab.
Okay.
Okay, any other discussion? If not, all's in favor say aye.
Aye.
All carried, thank you. Rick out there?
Patiently waiting.
Morning, Rick.
Morning.
Get your deer?
Pardon?
Did you get your deer?
Yeah, I got a nice 8-pointer.
Okay, good.
No brow tines, though.
Really? Reindeer. Go ahead.
Chair, the next board action is to award grants from the third round Small Business Relief Grant Program through CARES Act CRF funding. The background for this is third round Small Business Relief Grant Program applications have been reviewed for eligibility by the Grants Committee and are recommended to be awarded. The options are to award the grants approved for the Todd County Third Round Small Business Grant Relief Program or to not award, and the recommendation is to award the grants approved for the Todd County Third Round Small Business Relief Grant Program. The financial implications for this are $25,000, and this would include 5 businesses receiving grants, $5,000 grants.
Okay. You've heard the request. Is there a motion?
So moved.
Motion by Commissioner Erickson. Is there a second?
Second.
Second by Commissioner Kneisel. Discussion? Not. All's in favor say aye.
Aye.
Opposed? Carried.
Thank you.
Can we, how much money have we used up here? Have we used it all?
No. Nope, we have not. We set aside $1 million for this grant relief to small businesses and nonprofits. We have a little over $100,000 left. The board could continue to extend this until the absolute deadline of December 1st, if the board chooses to do that. I think there are still businesses that we could reach. We do have, with the next board action that we'll be bringing forward, we have some additional extended second round small business grant relief, and Rick has an additional 2 sitting in his office that he can approve that aren't even included in this amount, so.
Well, I don't know about the other board members, but I would like to extend it and see if we can get this funding out to as many people as possible. I know we got a thank you from the doctor in Barbara, which was really nice. He had called me, I called Chris, and she referred information to him and was granted this thing, and he was so appreciative of it. I thought it was a neat letter thanking
Yep.
us, and I think it just sends a message to us we should do everything we can to help these businesses, so.
We've received a number of emails from people
Have you?
really
Good.
appreciative of it.
Good.
Really helps at this time of year for them.
Could we, maybe this is the wrong thought process, could we extend the 10,000 to a 12,000, or give them another extra amount? Is that legal, not legal, what,
We could do a lot of different creative things. It's really the timing and how
Yeah,
much
I
time,
know.
it's taken a considerable amount of Rick's time. I mean, we could definitely take a look at that and see how we could serve them even more.
so do we need a board action to do that, or,
Mr. Chair, I would almost recommend that we continue to reach out, because that seems to be almost the best method of calling businesses directly.
okay. Okay,
Chair, I would make that motion to extend on what we're continuing to do with the $10,000 mark and just try to reach out to further ones. And my recommendation to any commissioners, if you hear of anybody, forward them on, because
Yeah.
a lot of people qualify that don't realize they qualify, so.
Mr. Chair, this week, actually last Wednesday, I called 6 businesses and they did not know of the program. And we have advertised a
Yeah,
lot.
I know. So should we set a date for extension too, or do we not?
The deadline is December 1st.
Here first.
So do you want, that's the
Yep.
deadline?
Yep.
Okay, so December 1st, there's a motion by Commissioner Erickson. Is there a second?
Second.
Second by Commissioner Newman. Discussion. Not, all's in favor, say aye.
Aye.
Opposed? Carried. Thank you. Good.
Thank you.
Okay, I think I have one more board action though, the second round.
Okay.
Okay, so we did extend the second round small business, and we're gonna continue to receive those applications, but we do have some awards that we do wanna get paid out, and in order to get that done, the board needs to approve it. So the background is, extended second round small business and nonprofit relief grant program applications have been reviewed for eligibility by the Grants Committee and are recommended to be awarded. The options are to award the grants approved for the Todd County Extended Second Round Small Business and Nonprofit Relief Grant Program are to not award, and the recommendation is to award. The amount for this round is $78,497, and that served 9 businesses and nonprofits.
Okay, you've heard the board action. Is there a motion?
So moved.
Motion by Commissioner Becker, seconded by Commissioner Kneisel. Discussion. Not, all's in favor, say aye.
Aye.
Opposed? Carried. Thank you.
Thank you.
Thank you, Rick, for all of your work on this program.
Okay.
We do have our standing discussion on CARES Act funds. I am just wanting to inform the board that I will be reaching out to the libraries individually, assisted living facilities, nursing homes, those types of facilities, just to see what additional help they might need.
Okay.
And that's all I have.
Any other questions, board members?
No, Mr. Chair, I just want to add that, listening to general government from AMC yesterday, a lot of the counties are not going to send any of their money back. They're going to spend it. So,
I think we have that intent too.
no, that's what their
Do we-
intent is.
Yeah, in relation to his question or comment, do we know how much is coming back from townships yet?
We're still waiting to get that total, and we'll have it before the end of this week.
And when do we meet next? December?
We meet December 1st, but I was hoping that maybe because of our very short time frame that we're working with, the COVID-19 Executive Committee would maybe take some actions and make recommendations to the board. And if we have to call a special meeting to finish up some of this, we can.
Okay, but it was my understanding that committee could not spend money. Is that right or no?
We could make recommendations and
But
call a
if the board doesn't
special.
meet until December 1st, is that too late?
We could call a special meeting.
We might have to.
Call a special meeting.
Yep, we
Okay.
could.
All right.
We do know that we'll be approving some grants on December 1st. I mean, we're gonna be
Yeah,
doing that, and
okay.
that's okay.
But I want to make sure we meet all the deadlines, so
Yep, I'm gonna keep a close
right.
eye on it.
you keep on top of that. Thank you. All right, any reports? I think we're all doing our Zoom meeting, which are getting a little old, but guess we continue to do them, so it looks like we might be doing them a long time, so. Then I will ask for a motion to adjourn.
So moved.
Motion by Commissioner Kneisel, is there a second?
Second?
Second by Commissioner Newman, discussion? Not, all's in favor say aye.
Aye.
Opposed, carried, thank you. And, we do have a work Motion,
5 minutes?
5 minutes.
Board meeting just ended, and they want 5 minutes, and they'll start the work. Thank you.
So Chris, what would a